Good morning. President Trump announced last night in an address to the nation, travel from 26 European countries to the United States will be suspended for 1 month.
KRCG 13's Gracie Matisse joins us live in the studio to tell us more about the president's address from the Oval Office.
Tony and Megan, good morning. The president says the restrictions will not apply to travel from the United Kingdom or to cargo shipments from Europe to the U.S. Only passenger travel from Europe to the United States will be suspended for 30 days starting Saturday. In the address, President Trump says there will be exemptions for, quote, Americans who have undergone appropriate screenings. The administration will be monitoring the situation closely, and there is a possibility of lifting the restrictions earlier.
A large number of new clusters in the United States were seeded by travelers from Europe.
In addition to the travel restrictions, insurance companies will be waiving copays on coronavirus testing and treatment per President Trump's request.
Now, organizers all over the country are canceling or postponing events to help curb the spread of coronavirus.
The same precautions are being taken here in mid-Missouri. KRCG 13's Gracie Matisse joins us in the studio to give us an update on the latest event cancellations.
Tony and Megan, in addition to events being postponed or canceled, the University of Missouri, Stevens College, and Truman State are suspending classes, and Lincoln University is extending their spring break. The Missouri National Archery in Schools program has canceled their state tournament in Branson. Jason Aldean concert, originally planned to be held tonight at the Mizzou Arena, has been postponed to August. Missouri S&T has canceled all St. Patrick's Day celebrations. And Special Olympics Missouri has canceled the Polar Plunge scheduled for March 21st. The Coyote Hill Pancake Breakfast, being held tomorrow, will now be online.
The Missouri Department of Social Services will be giving extra assistance for low-income Missourians who receive child care subsidy benefits. KRCG 13's Gracie Matisse joins us in the studio with a look at how the Department of Social Services plans to help families during the COVID-19 outbreak.
Megan, that's right. Officials are taking action to extend child care subsidy program benefits and provider application renewals for 90 days. The child care subsidy program will also be modified to pay for additional hours of care due to school closure or if a parent is required to work additional hours. The changes will also allow a licensed child care provider to exceed the capacity of their facility and to extend their hours of care during the time of emergency school closings. Temporary care of preschool and school-age children will be going into effect, allowing short-term licenses for a 45-day period. These licenses will be renewable and will be based on an abbreviated inspection that focuses on key health and safety indicators. Child Care Aware of Missouri is a child care resource and referral agency that assists parents in locating child care at no cost.
For those experiencing coronavirus symptoms, public health department officials are giving specific guidelines on what one should do. KRCG 13's Ashley Eddy joins us now live with a breakdown. Ashley?
Noah, officials say if it's not an emergency, just go to a local urgent care or a private physician.
Melanie Hutton, nurse administrator for the Cooper County Health Department, says if you are, however, short of breath and having difficulty breathing, that is an emergency and you should go straight to the emergency room.
That is a medical emergency. That would be different than you're having tightness of chest and a deep cough. There's a clear difference in that.
The key point, she says, is calling ahead due to differences each clinic may have, such as having staff meet individuals at the door. Those who do have a primary care physician are being instructed to reach out to them.
Emergency rooms are meant for emergencies, so if they are filled with non-emergencies, then it definitely causes a backup.
Hutton says doctors will be checking symptoms and then make the decision to test based on availability of testing.
Then it will vary because that doctor or hospital may have full access to private testing through a lab such as LabCorp or Quest, or they may have a limited amount of test or no test from the Department of Health and Senior Services, in which case the criteria is a little more strict.